People are lost generally. They really don't know where to start. They don't know the right questions to ask. They don't know what they should be looking at. So it's up to the community's connection, that person that touches them first, to really make them understand. And that's why I believed in creating my platform, that I want to connect people directly to those people.
What if families are not confused because senior living is complicated, but because the system guiding them was never designed to help them make confident decisions?
Welcome to From Leads to Leases, a CCR growth podcast that helps senior living providers transform their complex challenges into opportunities. Listen in for stories from industry leaders, innovative strategies, and insights. And with our expertise, learn how to increase occupancy faster, guaranteed.
Welcome back to another episode of From Leads to Leases, the podcast that dives deep into the senior living and senior care industries, bringing you insights, strategies, and stories from the experts at the forefront of innovation, leadership, and care. I'm your host, Jerry Vinci, founder of CCR Growth, the only demand generation agency that is exclusive to the senior living industry. And through this podcast, I'm here to guide you through the evolving landscape of senior care, exploring the innovations, the strategies, and leadership insights that are shaping the future of the industry. Whether you're a provider, a caregiver, or industry leader, this show is here to help you make informed decisions and create meaningful impact. All right. Today's guest is Steve Fecske. He's an entrepreneur and senior living industry veteran whose career spans publishing, film, technology, real estate, and senior care. After working inside home care, assisted living, and large senior living operators, including Emeritus and Brookdale, Steve experienced firsthand how difficult it is for families to navigate senior housing and long-term care. He's the founder of Your Senior Team, a consumer-first platform. It's really cool. You guys need to check it out. It's designed to help older adults and families research, compare, and connect directly with senior living communities based on their actual needs. Steve has built one of the first affiliate networks in the senior industry, connecting professionals across housing, care, finance, and community services to better support families during complex transitions. So, Steve, we got a lot to cover here. Thank you so much for joining us. I'm really excited to have you here.
Yeah, thank you, Jerry. It's nice to be here with you. Absolutely. Let's talk about what we're doing in this world today.
Yeah, no, absolutely. Just to kind of kick things off, talking about when families enter the system, most families, they don't plan for senior living. They're kind of forced into decisions during moments of crisis, during stress and urgency. So from your experience inside communities, what emotional state are families usually in when they first reach out?
It's a very big question because there's so many layers to what families and seniors are going through at the time that they have to reach out and find an assisted living. I mean, it's everything from a crisis, like they've had a fall or they've had an accident. They have to go into the hospital, and the family for the first time is starting to recognize that their loved one is not able to take care of themselves anymore like they could. And so now they have to face that with their parent, which they're not used to doing because they're not parents, they're adult children. And so now they have the whole dynamic changes, and that can create a lot of conflict as well. So there's many layers. The other thing is just someone realizing that they have to downsize. They can't live in the big house they lived in for 40 years, and now they've got all this stuff, and they've got all these things to have to, loose ends that they have to take care of before they can make the move. So there's just a lot of different layers to the issues that come in, but people are lost generally. They really don't know where to start. They don't know the right questions to ask. They don't know what they should be looking at. So it's up to the community's connection, that person that touches them first, to really make them understand, and they spend a lot of time there. And that's why I believed in creating my platform, that I want to connect people directly to those people. I don't want them going to a third party that really doesn't know what's going on and can't really use the information they get in a way that'll benefit them to the utmost to find that right place. So basically, you have a lot of people that don't understand the system and are lost, and yet they're under pressure. They might be needing to be discharged from the hospital and they can't go home. Now what I do. So there's that kind of tension when you're meeting with people. They've just been diagnosed with a terrible illness, and now the family's having to deal with a business as opposed to taking care of their loved one and dealing with that. So it's a very hard situation that they find themselves in so often. It's almost universal that you see this and happening because people don't prepare. They don't think about this. It's the last place they want to go. They like being home and living in the home they've known. So it's hard for them to consider that. And so that's one small step. And then there's all these other things of making sure they can afford it, making sure that they get the right care, uh, making sure that people are there to support them when they need it. So there's a lot of issues. And then you've got family members who are fighting, and one's in denial. Mom doesn't have the dementia, mom. And then that's conflict. So it's a whole myriad of things that you face with, and it's the salesperson, that person in contact that is going through all this and unraveling it, and it gets very tiring to have to repeat yourself over and over to tell the story to the next place you call. Then you go and check another place. You start over again, telling them your story. So it becomes very exhausting and very difficult. Uh, there's situations where adult children have to do the searching, and they now have to miss work. They have to take off from work and spend the time finding a place, or not be able to go with their children to see something or do something because they got to take time right now out to take care of mom or dad. There's a whole myriad and many levels of issues that you have to unravel and get people to feel comfortable enough to trust you and to move forward. Just you could see the complexity of the dynamics
Yeah,
of the
yeah.
situation. This is how many layers there are.
I've been in marketing for almost 3 decades, and through my agency, I've helped some of the largest senior living providers attract qualified leads and fill rooms faster while lowering their acquisition costs. But one thing kept bothering me. While working with larger communities, I kept meeting smaller operators, 10 to 50 bed communities that were struggling to compete with the big box providers because they don't have the same budget, staffing, or support behind them. And as a small business owner myself, I get that. You're wearing 5 different hats, you're trying to fill rooms while still giving great care, and that's exactly why we built Growthly. Growthly takes everything we've learned from helping large operators fill their buildings and makes it accessible to smaller communities without retainers, without long-term contracts or inflated costs. It's a performance-based partnership, and you only pay when we deliver move-ins. We help you stand out online, stop depending on referral agencies, bring in qualified families, and fill your community faster. Growthly is built for your small community and designed for big results. Learn more at growthlyseniorliving.com. Yeah, absolutely. This is, I always say it's one of the most emotional, complex decisions that someone will make in their entire lifetime. And I'm glad you mentioned preparedness too, because I feel like that's one of the biggest challenges. And it's amazing that even in this day and age of, you can look anything you need up online, that people are still so woefully unprepared. There were 2 data points that recently came out. There was an AARP study that said 19%, only 19% of families report feeling well informed when they begin their senior living search. And another one that said that over 70% of senior living decisions occur after a health event or functional decline rather than proactive planning. So nobody's really doing this ahead of time. Everybody's waiting until, they're in crisis before they even start.
Yeah. So I mean, and that's really one of the things that my platform does is that we're all about educating and letting people spend the time late at night, 24 any time that they could fit it in, to go into the marketplace of assisted livings and community memory cares, and to learn the different places that are available and what they offer, what are the things that they do, who the contact is there. All these things are laid out for them so they don't have to go searching. It's all centralized. And that's part of the problem with this industry and why people are so uninformed, is that it's fragmented. Every community is basically competing against another community. There's no cohesiveness in the industry. It's a big fragmented place that the shopper goes into and has to navigate through and try to find answers. And there's no one place to do that. So my platform does that. You can go one place and you can learn about all the different assisted livings in your area. Or if you want to move to another city or another state, you can find places there. Then you can learn about what they offer, their pricing, their accommodations. All that's there for you in one place where you can get that information and put in, and it goes against your needs. So you put in what you're looking for, what your care needs are. And then we bring you up a bunch of places to examine, and you can go in and look at them and study them. And then if you want to make contact with them, you connect directly to the community, not to someone who doesn't really know the community. and is only trying to make a referral fee, if you will. So, uh, that's, I think, a big part of it is that the industry is so fragmented and there's so much complexity to it that it makes people stop. They don't go out and take the time to study. So that's one of the things I'm doing is that I want to educate and let people be able to get well informed before they even reach out. And by the time they reach out, their information is available to that person they're reaching out to, so they don't have to go and repeat it. And a good marketing person will sell against those needs. So if someone has a care need, they're going to bring their healthcare director into the sales process so that they could feel comfortable that knowing they're going to get the care that they want. If their problem is health and diet and they worry about being maybe too much sugar, they're diabetic, I would bring in the chef who could talk to them how they manage this and how they make sure that the residents are getting the right nutrition and the right kind of diet. So all that I think is important, and I provide that. So it's given to every community if someone selects them, so they know how to talk to them. That first call is already productive because they're talking to them about their needs and the things that they've entered in that they're looking for. So I'm hoping that that's the process that will help people and maybe raise those numbers so it's not so low that people don't know what they're looking for and what they're doing. But I want to
Yeah.
increase that. So
No, you're lowering the barrier to entry for families because they're getting more information up front so that when they actually reach out to a community, they're already, halfway there. They've got some information that they need. They really just need to see the place in person often.
yeah.
Um,
And one of
I'm
the things
glad.
we do is we offer a virtual tour. So that's the other thing. These communities are producing virtual tours, but the only place they put them is on their website. So if
Right.
you and the website is a hodgepodge. I mean, most
Yeah.
websites are
Hard to navigate.
have hard to navigate, and so you're not aware. So that's the other thing. I'm creating a place where you can centralize. You can go in and prepare yourself and make some good options for yourself and then reach out to your list of places that you have to go and visit. Yeah, I think the barriers are the key, getting rid of those barriers. That's why I've connected the whole ecosystem because one of the barriers to moving into an assisted living is, you know what, I'm not ready. I got to sell my house. Well, the salesperson, what's your next step? Now what do? You got to sell the house. Now I'm putting them into my database. I've got to wait 3 months. But if I could connect that person directly with a senior real estate specialist, now it keeps going. I'm still as a salesperson, I'm still helping and connecting with the family and building that relationship. But at the same time, I'm bringing in other professionals that can help me overcome those barriers.
Mhm.
Same with elder law attorneys, people who handle finance and retirement, all are in this ecosystem that's available to seniors that they don't know to use. And that's really what's behind your senior team is that you really have a team of professionals that can help you age and make aging not a bad experience, but a smart experience and something with a lot of peace of mind and things. So that's the idea behind connecting that ecosystem so that you do overcome barriers.
I know traditional third-party referrals, not referring to your platform because I feel like people are coming in more informed, but a typical third-party referral, I think the conversion rate is anywhere from like 5 to 10%, maybe 12% if you're lucky on average, compared to like 20 to 30% for direct inquiries to that community. In your experience, when you were in the communities, I mean, how often did referrals arrive that were never a true fit for the community?
Most of the time. I mean, a lot of the time. I mean,
All the
that
time.
it just seems because there's always things that they don't expect that you have to overcome. So they're not coming in clear-eyed when they come into the community because this third party is filling them in on everything they need to know and what to ask and things like that. Most of the time, they come in. If someone like I used to run a community that didn't have memory care, and they would send me people who had when they got their 602 and they got that physician's report and the history, it said they have dementia. And so we couldn't take them. And that is so disappointing to families. They come to visit, they look around, they like it, and then it turns out the 602 says they have dementia and not just mild cognitive impairment. So uh, that's one of the ones. I once had a situation where I went through everything with the lady that was sent to me and showed her around, and she loved the place. Turned out she was a smoker, and we didn't allow smoking. So now everything that she liked and she was ready to go, she couldn't move in because she wouldn't give up her smoking. So, I mean, there's all kinds of things like that. Mostly in the memory care area, letting people know upfront what their care needs are. A lot of times people come and they have a much higher level of care than we can provide. They might have a sliding scale with their because they're diabetic and they can't give their own injections, and we can't assisted livings can't take those people. And so getting into that place with people is hard. It's hard to ask those questions. It's hard to find out, what's going on and get the dynamic right and get the health questions. It's a hard thing to do, and it takes a trained person. And a lot of times the third party have never really been in a community and know what happens. They're really dealing from a place they might have come from real estate, or they might have come from hospitality, but they've never been in the trenches, and that's really what I call it. When I'll never forget the emotional and the drain uh, on your nerves, and dealing with one family after another who's going through crisis and things. It's a difficult position, and people who are good at it are the kinds of people that are not only empathetic and treat people like they would their own parent, but they also ask the tough questions and make sure that they're helping the person get the right care that they need. So, but third party agents, that's why I designed the technology that you can connect directly to that key person at the community, not someone outside the community.
Yeah. Well, I feel like this mismatch between the referrals that are coming in and what the community actually offers has got to be a major contributing factor to the high rate of turnover that we see in the senior living sales space. I think it's something like, I think Argentum reported it was 35 to 45%, something like that, of turnover year over year. And I would think like obviously having to deal with those situations of breaking bad news to somebody, it's got to affect morale and burnout, like you're saying. I mean, having to do that over and over and over again, it's got to wear you down. I mean, being that person and having to deliver that news, I mean, what does that feel like to be delivering that to a family when that information could have been clarified up front, you know?
It's painful. I mean, it's one of the things that my parents instilled in me is I truly care for people, and I care about their well-being, and when you get into a situation that you immerse yourself with a family and you get to know them and you like them and all these circumstances, it's hard. It wears on you. It definitely, makes it difficult to deal with the circumstance. I mean, how do you tell someone, "We're sorry they can't live here anymore because they've got dementia?" And it's like, but you have to do it. You have to deal with it because they need the care. And the other thing is you're dealing with a community, so you don't want someone who doesn't belong into a community that might disrupt the community and might change the dynamic that they have in the community, and that's the balance that they deal with. But these are all circumstances that make it a difficult time, and why preparing and getting to know what's in your community. Why not take a visit to the assisted living even when you don't need it, just to know what they're
Yeah,
doing and get an idea. So
exactly.
that's a cultural thing. People in our culture, they don't want to deal with old age. They don't want to deal with aging. We don't want to admit it. It comes on us so quickly that we didn't pay attention. And so these are things that we need to change, and technology, ironically, is those one area where we can make these kind of changes, help people find out and learn and become more involved in understanding of what their circumstances are, and why people say or do things when they reach out. So I think that's all part of this change that's going on. That to make the shopper, the consumer of senior living more educated, more confident, more certain. We spend a lot of time building technology that will verify people's credentials, verify licenses. So the trust is a big part of that confidence, and being able to move forward and feel like you're doing the right thing for your loved one. And so, again, I think technology is one of the answers.
I think operators need to really think about the shift that's happening too with the way that our prospects and their families are searching. It's, you know, Pew Research said 88% of adults age 40 to 64 researched major life decisions online before speaking to a professional. And an interesting data point around senior living was that most senior living related searches peak between 9 p.m. and midnight. So you know that that's the family members who are doing that research
Exactly.
probably after their job, maybe after caretaking for a loved one, something like that. But I mean, in your experience, because you're in this space and you're helping families navigate these decisions, I mean, how have you seen that landscape change as technology has evolved?
Well, I think that the adult children are getting more and more involved, that they do take the horn by the bull by the horns, if you will, and take care of things. I think I see that a lot more. Again, one of the benefits of my platform is that you can actually get things done after you've put the kids to sleep. And now you've got to deal with your mom and dad. Right now, what has to happen is you've got to actually make phone calls and go out there and look at the place and then make a decision. Then you go to the next one. It's quite a process with and why I built this central marketplace that allows someone late at night or when it's convenient for them to go in and put in their information, put in what their needs are, their care needs, and actually come up with a list of places that they could then look at their virtual tour, look at photos, read about their care accommodations and their living accommodations, their social network. All this can be learned ahead of time, and then they could select them and save them for a future call, or they can ask to make a call or ask for their direct phone number, and then they can call them directly and say, I'd like to set up a visit. So just the process, I think, allows more and more adult children to get
Uh-huh.
involved and to help their parents. That I think that age, I think it cuts off at like 75. People at 75 and younger are pretty internet savvy, whereas people in their mid 80s, they're not as they kind of lived before the internet uh, came in. So they're not as savvy. They're going to rely more on their children. So I think it's both being able to do it as a family and have it centralized where here's a list of places. I've given you permission to access them. Go look at them. And then the family is now making this. And one's in Atlanta, the other one's in Los Angeles, the other one's
Uh-huh.
in Monte. All of a sudden now they can go in as a family and look at these places on their own and help make the decision together, which is, believe it or not, a very strong dynamic. Adult children, if there's more than one, they want to be involved in the decision making to some degree, generally. Now there are situations where one child is taking care of everything, and that's hard too. But
Yeah.
generally, that's the idea.
And I know, like, with a platform like yours, because the family's doing so much research and kind of whittling down their options based on the things that they need and what they can learn about that community from a platform like that. I mean, I got to think that benefits the sales team as well because they're getting more information about what this person's looking for before they even have a conversation. So, how does that change the first call? Like, how does that change the conversation?
It changes it tremendously. I mean, the first thing you've got to realize is that it's exhausting telling your story to people over and over and over again. So with my system, that's not necessary. That first phone call is about all the things they needed and talking directly. I see that your loved one needs bathing. I see that they need grooming help. Tell me a little bit more about that. But now you're talking to them about things that are related to from the very first minute you've started that conversation. You're already relating your place to them as opposed to finding out about them and then relating it. So it increases the connection with people because they feel like you've taken the time to know a little bit about them, and now you're talking to them on terms that they can make a decision on. And so it changes the first call completely. So that's part of the thing that I recognize. I can't tell you how many people after the third visit came in and they were exhausted. I mean, I felt bad asking her to come look at a room because she had been through 3 other places, probably walked a couple miles already, checking these places out. So it's just an exhausting experience in every which way. Whereas with being able to get this information out and connect on terms that have to do with you and are relative to you, it changes everything. And it also changes the ability of that salesperson to be more empathetic and understanding and to address the circumstances that need addressing. And they don't have to ask and they don't have to be told. So it changes the dynamic a lot.
It's interesting too, the shift that I've seen in terms of trust within the community space. It seems like consumers nowadays are more focused on transparency than they are on reputation. They want to know that the information they're getting is the straight answer, and that they're being as forthcoming as they can. And it's increasingly, like you were saying about collecting like licenses and certifications and things. I mean, trust, it's increasingly dependent on systems and verification. So why is trust now tied more to structure than reputation? I mean, how have you seen that?
Well, I think the people are inundated with information. So as soon as they go out and they say they're looking for an assisted living on the internet, they're going to get inundated with all the different communities that have paid to have that kind of marketing. So that so that's one of the reasons is that there's so much information and so much bad information, and there's people who are committing a fraud against seniors. So there's this whole approach when you're dealing with anyone in when it comes to seniors, that they're looking through one eye at you all the time, that they're not certain. They're trying to hear, and they're almost trying to convince that you are distrustful as opposed to being transparent. I mean, it's like that's the mentality coming in, is that I'm going to get someone, they're taking advantage of me. Somehow they're trying to take advantage of me. That's very frustrating, especially when you have all the best intentions, but it gets hard. So what we've done, again, putting things into writing that they could read for themselves and get ideas of what's going on in the community, be able to figure out key questions. I think that's one way. I tell families when they go to visit a community, you can talk to the salesperson. They're going to let you hear what you need to hear. So I always suggest go to lunch, have lunch. They can't hide the food. They can't tell you
That's
that
true.
it's something that it's not. The other thing is look at the people living there. Are they smiling? Are they talking? Is there interaction going on? Is there an energy in the room? All these kinds of things you can get firsthand on your own without having to ask a question. And then you could ask from there. But again, with us, it's all about knowledge, information, and it's being able to verify licensing, being able to verify credentials. There's nothing like that now. I can tell someone I'm a certified senior advisor, and which is a quite in-depth certification that's not
Yeah.
easy to get, but I can
Yeah.
put that on my profile right now and no one would know the difference. How would they know? So what we are doing is we're actually going out into that database, verifying that they are that, and then allowing them to put that credential on. They can't put the credential on if we find out it's not legitimate. So that's part of it. It's trying to build trust in that way. People understand certifications. They understand when they have a specialist title, or if they're uh, elder law attorney, they're going to have a credential that goes with that could be
Well,
verified.
let me ask you about that. I mean, how does verification change how families evaluate their options?
Well, I think it's just again, I think they will pick their places based
Hmm.
on a whole slew of criteria, but I think it's important that they feel that the person or the place is properly licensed. That's a key element. So that'll become part of that decision-making process. Um, that I think is just part of one of many questions and one of many ways of getting trust. I'll tell you firsthand, as the salesperson, that person that greets them the first time and shows them around and gets them understanding and knowing, I'm their biggest trust. As a salesperson, I create that trust, and I do it through, and this is every good salesperson. I always tell salespeople when I train them, get them to like you first. Get them to like you first. Because once they like you, then they're more likely to listen to you. And so, and there's ways of doing that, but one key way is understanding them and being empathetic to them and asking them the kinds of questions they feel you should be asking. And that takes quality sales. It's where the training comes in of a good salesperson when it comes to assisted living, is being able to have that empathy and being able to
Hmm.
know that you're treating someone because it's their mother or father, that it's important that you treat them in a way that you would your own. So I think that's part of the trust factor as well. So we can do things technically, but when it comes down to it, it's going to be that firsthand interaction with some other human being that's really going to push the trust factor forward when they finally make that final decision. And I find that to be true, that the salespeople do help families make the final decision is one place over another. It's that salesperson and the way they've been handled by that person when they came. That's critical.
Absolutely. From a owner operator perspective too, what assumptions do you think uh, about lead generation are no longer true? Well, let me ask that a different way. Let me just say, what assumptions about lead generation no longer hold true?
I think that the way that leads are generated now are changing, that you're getting a lot of AI types of forays into the marketplace, and they're selecting certain signals, certain events, and those are generating the leads. There's so many different ways of getting leads. I mean, one thing that I look into, because I do have a senior real estate background as well, and I go to my title company and I find out which families are been living in their house over 30 years. Chances are they're going to maybe need an assisted living one day. So that becomes a lead for me. But a lead is not a referral. A lead is just someone who's possibly a prospect. A referral is a prospect. And so that's a whole different jump. Leads are a dime a dozen too. I mean, you basically go out there and you scan the internet based on certain criteria, and you're picking up leads. You're getting the websites have these programs where you chat with a robot, and they ask you the right questions, and you submit them, and that becomes a lead. So I think technology is getting more and more involved in leads, and it's a matter of can technology qualify the leads, and that's really what we do is we take that lead and then educate them and
Mhm.
let them reach out and look at photos, look at all the things. And that lead now becomes an educated consumer who is now confident in reaching out and finding the places they want to go to visit and things like that. So I think leads are going to get more efficient as the technology becomes better. And I don't know if that answered your question, but
Yeah, no,
okay.
that's a great answer. Thank you. um, I want to talk a little bit about your senior team, your premier platform, and just get an understanding so uh, owners and operators can understand how the platform might work on their end and how they could use it to their benefit. Maybe you could talk about that a little bit.
Sure, sure. So, my platform works on three levels. The first level is the community putting themselves in.
Mhm.
It's free, completely free to put themselves in. They put in all their photos. They could put a link into their virtual tour. Everything goes into that, and their contact information. When the consumer comes in, they're basically either going to put in a name of a community they're looking at, or they can put in an area, a zip code, a city. They could put the type of care they're looking, whether it's assisted living, independent living, residential board and care, a 6-bed, or they want a CCRC. They put in what they're looking for and then the price range or budget range. And then they submit that, and up comes a whole slew of places that are available to them that they could look at and learn about, and then narrow it down, save it to their dashboard, the one they like, they want to go back to, or they can connect directly. So that's that level. And then what I've also created, the salesperson in assisted living spends so many hours networking where they have to go out of the building, and they have to go to networking parties and go see skilled nursing social workers and all this footwork that has to be done. With my system, I've created a virtual networking capability. So you can refer other professionals in the ecosystem, and professionals can refer you. So I've added that level into the process where now you can actually make networking, meet colleagues, people who also deal with seniors, but in different capacities. And now you can become a team of people that prefer each other and trust each other. And the system allows you to do that virtually, where you can put in a client you have and send it to a senior living community to look at and to contact. And that becomes a referral. And we actually pay a 15% referral fee reward to those people that send referrals that turn into a referral. And so uh, that's one of the areas we've also changed. So we've created this virtual networking capability so that referrals come not just from the marketplace, but also from other professionals. And then the third level is the affiliate level. So
Mhm.
one of the things I saw in the ecosystem, because I'm trying to institutionalize this ecosystem and through verification, through knowledge. And so one of the areas that we felt was missing is that the retailers, the small pharmacy, the social worker, the geriatric doctor, how do we reach them? Well, through our affiliate program, these people can promote the assisted living, promote the whole marketplace for seniors, and actually get referral fee rewards from people that they send into our platform that actually convert into some sort of a sale or a client. So that's the third level. So we've really taken everything that we live through in the real world, in the analog world, and
Yeah.
digitized it, made it a virtual capabilities that really makes us more efficient and makes us better at what we do, because now we have records of everything and we can really build relationships that not just warrant goodwill, but also revenue. And you could actually make money by referring your colleague because you're involved in the transaction through our platform. So that's essentially what those are the three areas that we've really focused on. And I guess it's 4 when you consider the B2B side of putting your community in. So,
Right. Right. I love what you're doing. I think, building a healthy ecosystem rather than a predatory referral site where, people
yeah,
are being mismatched left and right. I think this is such a great way for people to get all the access to the care and the other solutions that they need within the senior living space. So I love that. Thank
yeah, no,
you. Thank you
no,
so much for sharing all that.
it's my pleasure. I really appreciate getting the opportunity. So thanks for what you do.
Yeah. Where can our audience go to learn more about your senior team or connect with you directly?
Well, if they go to the website, yourseniorteam.com, they could go there. My phone number is all over the website, so they can call me direct. I'm still at that stage in development where I'm still directly involved, so people can call me on that phone number, or I can give it to you now. It's uh, my email address is steve@yourseniorteam.com, and my phone number is 661-713-3500. And people should feel free to call me and ask me questions. I love the contact and I appreciate it.
Awesome. Great. We'll make sure we get all that into the show notes. So, all
Thank
right.
you.
As we wrap up today's episode, I want to thank Steve Fecske for sharing his perspective on what happens when families are given clarity, control, and direct access during the senior living search process. From his time inside communities to building a consumer first platform, Steve's experience highlights both the cost of fragmentation and the opportunity that comes with transparency. So, if you want to learn about Steve or explore your senior team, we've included his website and contact information in the show notes. As always, we hope you found this episode valuable. Don't forget to subscribe to the podcast on your favorite platform and stay tuned for more conversations exploring the realities of senior care, from marketing and sales to trust, technology, and family experience. And remember that From Leads to Leases is a video podcast, so you can watch full episodes on YouTube or Spotify. I'm Jerry Vinci, founder of CCR Growth. Thank you for joining us. Please like, subscribe, and share this episode with anyone who might find it useful. Until next time, lead with strategy and with heart. Chat with you again soon. Thanks, Steve.
Thank you, Jerry. Pleasure. Take care. All the best.
Thanks for listening to From Leads to Leases. Are you ready to fill your rooms faster and increase occupancy? Visit ccrgrowth.com to learn about our Senior Growth Innovation Suite, a proven system to generate highly qualified, tour-ready leads, accelerate sales, and reduce acquisition costs. Let's connect and turn your challenges into opportunities. See you next time.